I was asked the other day about a patient specifically who had an AMH above 6. Her other studies evaluating the presence of PCOS appeared to be negative. Her androgens were normal, for example. She did have a polycystic ovarian appearance on ultrasound. And the question is this really what's leading to her chemical pregnancies and inability to conceive a healthy pregnancy? So let's kind of break it down just a little bit. AMH, as we know, is a hormone made by the immature eggs in your ovaries. So the more eggs you have left, the higher your AMH. The fewer eggs you have left, the lower your AMH. That's kind of logical. The problem is that there's some data that suggests that if your AMH is really high, and nobody has really defined what really high is. I mean, certainly 20s are really high, but is 6 really high? Is 9 really high? But if your AMH is high, does that associate with poor egg quality? There are a couple of papers out there that suggest that in fact egg quality may diminish if your AMH is really high. But there are a lot of other studies that suggest, and certainly my experience suggests the same, and that is that if you've got a good AMH, enjoy it. If it's in the 20s, clearly your physician is going to need to stimulate you very, very carefully because you may be very brittle. You may very well take off when they start to stimulate you, and your estrogen can really skyrocket, and that can be associated with ovarian hyperstimulation syndrome. So the bottom line is that everybody with any kind of an elevation of their AMH needs to be individualized as far as their care goes. And let me go back to the basics. What are we really saying if you have PCOS? We're saying not only do you ovulate irregularly, but you have a statistically significantly increased risk of diabetes, potentially requiring insulin, high blood pressure, and heart disease later in life. So PCOS is not something to ignore, but on the other hand, an elevated AMH alone does not mean that you have it.